Actually, these colours haven't come out very well, but this is in what we think is going to happen in a high-carbon world. Actually, this is going to be on a website, isn't it? It's basically none of this area here is going to be inhabitable at all. This is all bright orange in the original slide. And the proposition is by the end of the century, New Zealand will have a high number of intense, highly settled cities with some intensified farming around it. It comes from the New Scientist in 2009. There's dramatic changes in population and what's going to be required from us. Thanks. Okay, so the WHO Commission on Social Determinants of Health looked at this problem of climate change, looked at the fact that we already have inequalities between the countries that are industrialised and those that aren't, looked to see that there was already inequalities within countries, and said this really can't continue. We have to, if we can find billions of dollars in the economic recession to bail out banks, we've got to be really thinking about where we should be investing to make sure that the health of the country that health is spread more widely. It's the right that everybody should be able to have to live the kind of life that they value. Thanks. So the area that we decided to work in, my colleagues and I, and Helen Viggers is sitting there in the second row, who has helped me with this from the beginning, is that we looked at housing. Because we saw in that climate change, and we were wanting to do something about climate change, the things that we have the most effectiveness is trying to improve our housing. And we know that our housing is very old. It's basically the same as it's built the same now as it was built 100 years ago. And most of our houses are about 90 years old. We spend most of our time inside our houses, and yet they're about 16 degrees, much colder than they should be. And moreover, we know that a lot of people die in winter who don't need to. These are called excess winter mortality, and we have one of the highest rates of excess winter mortality in the world, which is surprising because we live in a temperate country, but our houses do not protect us well. And as the price of electricity has zoomed up, the Comalcos has remained absolutely stable. They take 15% of our electricity, so their price hasn't gone up, but ours has gone up dramatically in our residential houses. We have seen no improvement in the number of excess winter deaths. And it's a problem that's been neglected. We hear a lot about road accidents, but we don't hear much about excess winter deaths. So these are private deaths. The houses are considered private, so we don't think about the public consequences of that. Now, in here, I've been collecting bits from the paper about where you see the consequences of cold houses, but they're not necessarily linked to it. This is with these 7 babies who died in cot death, and they went to the coroner, and there was a very sad stories with one of the young mothers here, and they were sleeping in the same bed as the parents, and the young mother says here, but our house was so cold that they're better off sleeping together to keep warm. So she had option of either putting her baby in a very cold room or having it together with her in the same bed. This couple, older couple, were in a very cold house, and they felt so strongly about it they were prepared to be photographed. They spent a lot of their day in bed because they were so cold. Of course, that's not very good for your circulation if you're in bed all the time and not able to move. And we find in our studies a lot of people who spend a lot of time in bed when they should be out and around because their houses are so cold. Or they're sharing one room of the house, which they heat. And that's, of course, where there's lots of infectious diseases in New Zealand, means that it's more easy for close contact infectious diseases to swap. We know from Capital Coast Health at the moment that Pacific Island people have 20 times the rate of swine flu that Palangi and Pakeha have at the moment. And we think this is in part because of the need to keep warm in one room of the house rather than using the whole house. So the Governor-General talked about willing partnerships. And we think that this is a really important way of creating information to inform the community, inform community groups, by forming partnerships at the beginning. So we've always worked very closely with ECA, with the Ministry of Health, with district health boards who've been very supportive of our work, with PHOs, when working with Richard originally in the Rata branch of the Māori Women's Welfare League, going out and seeking community agencies who are interested in improving housing. And we make sure that we speak the language of the engineers and the physicists as well as the economists, as well as community talk. And I think when you're linking through people in communities and Māori communities, much easier to actually really put flesh on the Treaty of Waitangi and really have a memorandum of understanding with local Māori organisations. Thanks. Of course, one of the things that you can do to improve housing is actually build better housing, and this is the first State House, which is just about 1 kilometre over the way here, on the way to the airport. First State House that was built, and that had high thermal mass. It was built of bricks. It faced north for the first time, because you know the first century of houses in New Zealand all faced south, because that's the way that they faced in England, and nobody thought to actually turn them around. Māori kāinga were much better built, oriented towards the sun, had a lot more thermal mass in them than Pakeha houses were originally. Thanks. So in the first study, we thought, well, if we're going to try and improve the energy efficiency of house, that's one thing that's very useful. Let's see if we can link it through to health as well as to climate change. And we're trying to add up the benefits to make co-benefits, rather like beads on a necklace. A necklace has beauty if it's got more than one bead. And we're trying to say that each one of the beads is a benefit. So we want to show that we need to spend less money on electricity if the house is more energy efficient. That will make people healthier. They'll go to school more often, and it can help the climate at the same time. And it was carried out in 6 different regions, from West Coast, Christchurch, right up to Otara, Taranaki, and also the Eastern Bay of Plenty. And this is Te Iwi o Rakapaka. I and my colleagues, a team of about 10 people, went round and had hui and whono at all these places to explain what the research was. And we found that indeed there was a bead, there was a pearl, which was people did use less electricity. Their house was warmer, so they were able to have some comfort, but they also had to savings in their back pockets. And most particularly, they weren't exposed to those very cold temperatures where we start shivering below about 10 degrees. And it's when you start shivering and getting really cold that we think your immune system has to work that much harder and is more susceptible to disease. And if you've already got some kind of coronary condition and you're really cold, your blood gets thicker too, and you're more likely to have an angina attack or a heart attack. So it's not good to be exposed to these very low temperatures, and it's not good for very young babies too, whose thermoregulatory systems don't really functioning well. Very young people, old people are particularly vulnerable. Thanks. And so that was good. It made the houses warmer, but we found that it had an effect on health, and that was very exciting because I work in a Department of Public Health, and I'm trying to work out ways of improving the health of the population. Now, I couldn't have done this without all the community agents that we worked with, and they were delighted too. That showed that the people felt much better in these kind of houses. They had fewer days of work, and there was a trend to them having less hospitalisation. And we did working with an economist, we found that the benefits were 2 to 1 of when the houses were insulated compared to not. Now this was really important when it came around the cabinet table, because if they're deciding whether to spend money on roads or on housing, if we can show that the benefits outweigh the cost by 2 to 1, then that's very advantageous. And each of these is a bead, a benefit. And we could not have produced these results had we not been working with health promoters and PHOs and district health boards, these community trusts who are trying to improve energy efficiency. They were the ones who linked through the communities and found the people in those communities who would benefit.